Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe in the studios of our flagship stations, 89.3 Lakes FM and Civic Center TV. In addition, today, as always, we're on Birmingham area municipal access. Both our TV channels, Comcast Channel 15 and AT&T Channel 99. On the radio, of course, 89.3 Lakes FM in West Bloomfield, Keego Harbor, Sylvan Lake, and Orchard Lake, as well as on 88.1 WBFH, The Biff out of Bloomfield Hills, the Birmingham Bloomfield area. Their operations out of Bloomfield Hills High School on Long Lake Road. And online today, as always, civiccentertv.com. Click on our Watch Live link or view the small player at the top right of our homepage on your computer browser. You can also find that on the web browsers on your mobile phone and tablet as well. And we're on Facebook, facebook.com/civiccentertv15 and facebook.com/lakesfm. And as always, joining me from her home studio in Keego Harbor is Ronnie Dahl.
Tyler, I'm so excited today.
What are you excited for today? What's got you excited today, Ronnie?
Today is National Eat What You Want Day.
Oh, okay. Very nice. So what do you want to eat today, Ronnie? What are you celebrating with?
Well, I will say I'm going to the Tigers game this evening. So
okay.
I guess really, can you eat at the Tigers game? I think you can, right?
I think you have to, because you have to eat your sorrows away from seeing such terrible baseball from the Detroit Tigers. But it's also Eat What You Want Day. So I'm just like, are they going to tell you no? It's last I checked the calendar, it's not just a Tigers home game day. It's Eat What You Want Day. I want to eat at a Tigers game. What are you going to do about it? Come out here, Avila.
I didn't know if their concessions were open, but I think they are. Hey, Woody.
What?
The Tigers, are their concession stands open?
Yes.
Oh, so the resident expert here at the Woodruff household says that yes, the concession stands are open. So, it's the junk food at the ballpark.
It's part of the experience. It's a key part of the experience there. It's part of the environment. People go there and they can enjoy a ball game. It's like going to a movies and having some popcorn. You go to the ballpark, you have some ballpark food, enjoy a good time. Other than, of course, watching your team most likely play some subpar baseball.
So I am sitting here. I was like, if I can eat, let me grab the mask that my sister made, right? The ones you can zip them and then you just open them so you can eat and drink without taking your mask on and off. But now I'm like, well, it's not going to match the colors.
Oh, no.
It's burgundy. I need I need a blue or a gold one.
Yeah.
Because for us, I could care less about the game. I'm just going because my girlfriend has free tickets and needs someone to go along with her. So I'm like, okay, I'll go. But you have to match. It's the outfit.
Of course.
And it's the,
Yeah, you never want to be in a situation, too, where you could potentially be wearing the colors of the other team. Then all of a sudden you're in a position where, are you a fair weather fan? Are you a fan of the other team? Then you're getting all these dirty looks. You don't want to be doing that. It's a nice day. It's Eat What You Want Day. It's supposed to be happy, right?
Hey, it's also a National Twilight Zone Day. So What's that say?
Every day is National Twilight Zone for me over here, Ronnie. So it's no different.
I know. Are you a little lonely in the building over there by yourself?
A little bit. We've had Larry Nyland over here working on some TV magic that's coming your way next week on Civic Center TV. So it's been a little less lonely than it was over the last couple of weeks as we took these latest precautions here at Civic Center TV during Michigan's COVID-19 surge. But it's not too bad. I'm kind of used to this at this point. There's been several long periods of alone time working here each and every day at Civic Center TV at our Green Media Center offices, so it's nothing all too new.
I'm not going to say. I don't mind it because I have my slippers on. Usually I have on my sweat bottoms or something of that nature, or gym shorts, but I did put jeans on today.
Yeah, that's part of the fun of working at home and having all your business and all your communications with other people being just a medium close-up or a medium long shot is you can be comfortable, be seated back, and then be professional from the waist up on the camera so that you can, of course, be presentable for television and for your meetings as well, but still be comfortable. I'm still comfortable here. I like to stand when I'm working anyway, so being able to stand behind the desk here and operate everything, it's still pretty comfortable for me anyway.
We need to get you one of those treadmills.
I think that would be even more dangerous because I am I am kind of clumsy. I do tend to trip and walk into things and, bang my head on things. So, being on a treadmill, I've tripped on a few treadmills before. It's actually been pretty funny. It didn't feel very good, but it was hilarious. So that's okay. I think that would probably be a situation where, much like getting up on these rolling chairs we have here and the potential for falling when you're climbing up onto those, I think the potential for falling while walking on a treadmill and operating a board is probably a hazard we would want to avoid.
Yeah, but you have seen there are some people now that are doing that, like their work desk. They're getting a treadmill and then putting their computer up on top of it,
I
so
think
they
they're
can try to
asking
get
for trouble.
exercise.
I think they're asking for trouble. I think you need to take a 30-minute break and do a little walk on your treadmill, and then go back to your work instead of trying to walk, chew bubble gum, and operate a treadmill all at the same time. I don't know. You're asking for it. At some point, someone's going to take a tumble. Their work's going to fall down. They'll do it in the middle of a Zoom meeting. It'll be hilarious for everyone except for them. I don't know.
Hey, so Tyler, I'm sure you saw this. Michigan, we hit a milestone yesterday. We were so close, and we finally reached it. Michigan hits its first vaccine threshold for the governor's restriction plan. So Michigan hit the first trigger for easing COVID-19 restrictions under governor's vaccination plan Monday, an achievement that will soon allow businesses to return more employees to in-person office work. So Michigan had 4.45 million residents with at least one dose of the COVID-19 vaccine, equaling just above 55% of the population age 16 and older. That's according to the CDC. So Whitmer called the benchmark a huge milestone for the state, encourage unvaccinated individuals to get their shots. The restriction on in-person work is set to ease May 24th. And that's according to the state's COVID-19 dashboard. And we know the next big number everyone will start to watch for is that 60% benchmark, which really is so important for so many of the businesses as well.
Yeah, and it's really good news for a lot of these businesses, for other operations, and just some good news for us to all look forward to. And on top of that, another positive from hitting this milestone is it could potentially be even further encouragement for those that are still a little bit on the fence about getting vaccinated, that we are getting so close to being out from under the restrictions of this pandemic that have been in place and been taking precautions for over a year, that maybe that pushes them along. We did report yesterday on our headlines that there's been an increase in those getting vaccinated. It was up about roughly 2.5% over the past week from the previous week before the vaccination. So numbers are already looking up as it is, and we've hit that first milestone. So hopefully we can get to that second one pretty quickly. And then, of course, at each of these milestones, those restrictions that are lifted or are changed and modified, those don't go into effect for 2 weeks after, so that everyone can be through the full period of getting the full effect of those vaccines.
And I will say, though, you kind of question that, because it's not to say the people returning to the offices are the ones getting vaccinated. So that whole waiting 2 periods, I understand, because that's when you're fully vaccinated. However, the people that maybe helped us reach that threshold may not be the individuals returning to the office.
Yeah, and that's something that hopefully would be addressed office to office. We've been speaking to business organizations such as the Small Business Association of Michigan and various chambers of commerce who have repeatedly said these offices have plans in place and have had plans in place to prevent the spread of COVID-19 in their offices. Hopefully, as those have been modified over time, they've come up with plans that as they come back to the office off of these current restrictions, that they're basing that somewhat off of who may be vaccinated. Now, to some extent, they can't really enforce that because there are HIPAA laws in place, and people do have the right to keep their medical information private. So that is a valid question, because people are going to be returning to offices. People will be returning when these capacity limits start to increase. And there's really no way of knowing, short of asking and getting honest answers from people about whether or not they've been vaccinated, to know if those people that are in fact returning are vaccinated or not.
And so with that, too, we do know that the vaccine can't be mandated at this point because it is still only authorized under emergency use. It has not been fully cleared by the FDA and the CDC. So once that happens, we know Pfizer has actually applied for that variation to be able to say, get that full authorization, but that has not happened yet. And until that happens, it cannot be mandated. So that's really kind of one of those points. So we'll see how this continues to change. One thing, though, Tyler, that could help us get to that 60%, the FDA authorized Pfizer's vaccine for kids 12 to 15. We pretty much knew this was going to be coming, but the FDA Monday lowered the age that people can receive Pfizer's COVID-19 vaccine here in the U.S. to 12. Canada, I believe, approved it last week, a move that is expected to make millions of more shots available. So the Pfizer vaccine was authorized for use in people ages 16 and up in December, and now the FDA has amended the authorization to include children ages 12 to 15. However, the Advisory Committee on Immunization Practices for the Centers for Disease Control and Prevention, they are going to be meeting Wednesday, tomorrow, to update its recommendation for who should receive the Pfizer vaccine. That's a needed step in this. It's anticipated they are going to give the green light. And then if the head of the CDC signs off on the committee's recommendations, the first shots for kids 12 and up could come within days. They're saying as soon as Thursday. Now, remember, the 2 Pfizer vaccine doses would be exactly the same as what are given to adults, and 3 weeks apart as well.
Yeah, this is welcome news. This is going to be welcome news should it be approved and start getting these shots into the arms of these kids, especially for our schools as they're coming out of this current school year, as they're getting ready to graduate. A lot of kids, which of course in this case the age range this isn't the age range of kids that usually are graduating, but as they're planning for next school year and trying to get kids back into school full time for in-person instruction, having the kids as well as the staff at these schools be vaccinated would be huge for the local economies going forward over the summer. It's big for summer camps as well, especially those that have a lot of indoor activities, to be able to increase capacity, which allows them to bring in more money from not tuition fees, but those that are for paying the fees to attend those camps, which is big for them as well. And it helps us get closer to that 70% threshold. Now, it does kind of change the numbers as well because there are more people that are eligible in that 70% to get to that 70% threshold. But if parents are able to get their kids vaccinated, and we are then slowly but surely continuing to approach that with the rest of the adults that are currently vaccine hesitant, we may be able to see this current increase in people getting vaccinated over the last week or so continue to go up, which is nothing but good news as we approach that second reduction threshold in Whitmer's Vax to Normal plan.
We should try to get a couple parents on the show. I'll reach out to some of those in my neighborhood to see how do they feel about this. Are they hesitant? Are they not hesitant? It's different as an adult, and it's you and it's your body. But we do know kids have a different immune system than what we do. So it would really be interesting to hear from some parents directly about how they feel about this.
Yeah, and it's going to be a decision of the parents because, of course, unlike the adults 18 and over who have the ability to consent themselves, the parents are going to have to consent to medically allow their kids to be vaccinated against COVID-19. So it is going to also come down to parents and their vaccine hesitancy, either for themselves and or for their children, whether or not children are getting vaccinated. All the more reason why we're seeing so many efforts right now to curb vaccine hesitancy and reach those people that have been either apprehensive or just a little bit nervous or waiting to see what happens with other people who get vaccinated, and convincing those people that they are safe to go get vaccinated and get their kids vaccinated should the CDC follow up the FDA's authorization of the Pfizer vaccine for kids 12 to 15 years old.
Sorry, Tyler. I'm just sitting here and I'm like watching the spider crawl up from a web, like one web all the way up to the ceiling.
Wow, it's really going on. It's going on a journey.
So I'm throwing things at it. Yeah. I might have to call my husband to come to my rescue. Oh, no. Hey, another sign, by the way, that we are getting back to normal. MSU lifts the outdoor mask mandate. So, I always throw these Spartans, of course, stories in here for you. Michigan State University on Monday lifted its outdoor mask requirement after changes by the CDC and the State Health Department. So as of Monday, if you're going up there to East Lansing on campus, masks are no longer required in outdoor settings on campus or MSU affiliated properties for individuals or small groups, except for gatherings of 100 people or more. That's according to MSU's president. Anyone who is fully vaccinated, not experiencing COVID-19 symptoms, not required to wear a mask at residential gatherings, including those that are indoors. Face coverings remain required, though, indoors for those that are not vaccinated. Meanwhile, the city of East Lansing has also let the university know it is potentially going to be changing its face covering policy as well. East Lansing City Council is set to consider a policy resolution today that, if approved, would eliminate the requirement to wear masks in downtown outdoor public spaces starting on Wednesday, May 12th. So another good sign that we're starting to get back to normal here in the state of Michigan, Tyler. Yeah,
and it's not entirely surprising that Michigan State has done this at this point because of the process, the spot that we're in, and the vaccination process statewide, with requirements from the state being reduced in the My Vacc to Normal plan from Governor Whitmer and the Department of Health and Human Services. That's progressing forward, and so are other organizations, other cities, and universities such as Michigan State in their restrictions as well. Plus, on top of that, school has recently concluded for the spring semester, so the majority of students that are on campus throughout the regular fall and spring semesters are not going to be on campus all summer long, so there's going to be less people roaming the campus in East Lansing each and every day and gathering together. So that also provides an opportunity for them to lift restrictions without a whole lot of worry that they're going to be mass gatherings that you see for parties and other social gatherings on campus that could potentially lead to spread of COVID-19, as we've seen multiple times before. East Lansing kind of matching that as well, or plans to match that as well, and kind of go toe-to-toe with Michigan State. Also probably because of the situation now that we're in, where the college kids are starting to leave the campus for the summer. There'll be less people in the area, and on top of that, the vaccine efforts are going strong right now. So good to see that also. It's another sign of progress as we try to inch our way out of the COVID-19 pandemic, Ronnie.
So with that, Tyler, we're going to take a quick break here on the Megacast. I'm going to try to get this spider so that it doesn't fall on my head throughout the show. When we come back, though, we'll be joined by Lieutenant Tilli from the West Bloomfield Police Department. That's next here on the Megacast.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine. Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful, because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
In times like these, we have to believe in each other.
And we believe that you'll do the right thing.
When it comes to stopping the spread of COVID.
Follow the 3 W's.
Wear a mask.
Wash your hands.
Watch your distance.
And when it's your turn to get the vaccine, take your shot.
It all comes down to the golden rule.
Treat others the way you want to be treated.
We're so close, Michigan.
We can do this together.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
We want to say thank you for taking time out of your day to be with us here on the Megacast. I'm Ronnie Dahl here in my spider office in Keiko Harbor. Mr. Tyler Keith holding things down back there, and West Bloomfield. Joining us now on the show, let's bring in Lieutenant Tilli. He's with the West Bloomfield Police Department. Lieutenant, I'm sure you've had to kill spiders for your family as well.
Yes, I'm concerned about you. You look very stressed. Okay.
I know you guys, how big's a spider? I'm like, that big. No, it was really about that big, but still, I didn't want it to fall on my head during the show.
It's totally understandable to have, be afraid of spiders, I think. Especially big ones like that,
So, hey, Lieutenant, how are you doing?
I'm doing very well, thank you. How about you?
We're good. Bring us up to speed. How are things in West Bloomfield? It seems like things have really started to quiet down. Knock on wood.
So things are going well. The agency's doing fine. Nothing really significant to report in the police world aside from the the current issue with the pandemic. But that seems to be leveling off a little bit, while Michigan is still pretty high as far as the COVID Now Act Now tracker is reporting that we're still considered a very high risk. But the trend is downward, so that's good.
And so with that, Lieutenant, if I can ask you, what's just the overall mood change, if there is one, amongst the rank and file right now as vaccinations are ramping up and our numbers are starting to decrease here? Are people feeling more comfortable?
So I think so. We've reached a comfort level with the officers out on the road that they just wear their masks. For all contacts. It's become a habit, like locking your car doors when you walk away from it just becomes habitual, and that's a good habit to have right now. Vaccinations are in the low 40s for first time, and our first injection, and the mid 30s for fully vaccinated in the state. So that's good. We're really pushing vaccination here. It's been offered several times. To the officers so that they can either go to a hospital or a clinic or something like that. So I myself have been vaccinated.
And it is, and we should say too, it's so different than just a few months ago when we were talking about the vaccinations, and we know that your department helped the fire department over at Fire Station 1 and directing traffic, but now we know the supply and demand have intersected. There's more supply than there is demand, so it is fairly easy. Actually, it's so easy. I got mine at Ford Field, the Johnson & Johnson one and done. You're in, you're out, and plus you get free parking for the day. So
can't beat free parking.
Right, especially in downtown Detroit. With that too, just going forward, I will say one of the great things, the little things that make you smile is going to Target and seeing all the shelves stocked. You can get wipes now, you can get toilet paper, you can get cleaner, you can get pretty much anything you want, hand sanitizer. So with that too, does that help kind of feed into easing the fear on the side of our first responders, because we know people are able to get these products to help keep, themselves safe as well?
Well, of course, hand sanitizer was at a premium a year ago. And now, we have a fair amount of it, and all the officers have their own sanitizers in their cars and stuff like that. So we're really doing well. Actually, in the United States, we're very lucky. I was just talking to some of my Canadian relatives, and they have to wait 6 months for their second shot because they do not have a surplus of vaccination shots. So we're very lucky here.
Yeah, that, sometimes we just have to put it in perspective as well. So with that too, can we talk a little bit, how are you guys doing on staffing right now?
So our current maximum staffing for police officers is 82. We're going to hire 7 officers in 2021, or at least attempt to. Application pool is pretty short right now. You need an associate's degree and the police academy to get hired from outside the agency. But if you've worked as a police service aide for a year, we can hire you if you're one of the top candidates, and we will pay for you to attend the police academy. So that's a real benefit. We consider ourselves a destination agency. We have excellent benefits, training, and opportunities. I don't think you're going to find very many agencies with any different units as we do. Honor Guard, Detective Bureau, the drone unit, the UAV unit, firearms, special response team, federal task force assignments. And there's really a lot of opportunity here and no shortage of training. So we think in the long run, as a destination agency, we're going to be choosy. And if we're a few under maximum staffing, we're going to really hold out for the best candidates.
So I will say, it sounds like you have a new unit, the drone unit. I mean, 10 years ago, would we even be mentioning that? That is so awesome.
Yeah, so a couple of years ago, we purchased an unmanned aerial vehicle. It's a drone, as everybody knows, it's common terminology. And we'll use that on major investigations, traffic crashes. And we have, you need a pilot's license, not like you need to fly a plane, but a different kind of pilot's license through the FAA to fly this in certain areas and for professional use. So we have specially trained guys, and they have their own little unit. They train once a month, and they're very good at what they do, and it's been very helpful several times now.
Have they ever crashed and lost one?
I believe the very first time they launched, they had a failure to launch on the very first time. But since then, they've taken off the guards that I think they had on by accident, and it's been okay. Nothing major occurred.
It is becoming more common. We know even in the media, the industry, they're starting to use the drones a lot more as well. I worked with a photog who had his license, and it really does. It's amazing what the drones can be used for, but also it is a really great new tool for law enforcement agencies as well. And so with that, I think too, when it comes to West Bloomfield, is there's been so much support from the community when it comes to pay and benefits, because we do know, a few years ago, so many agencies or cities were having to cut their budgets because, it's an up and down roller coaster, whereas in that regard, West Bloomfield has been pretty steady.
Yeah, we've been very we've been very, just total loss for words there. Fortunate to have the support of the township board and the citizens. The public safety millage passed very easily last time. We've had no real issues with pay wise. I think we're very well compensated for the work we do. It's really I believe the social attitude that's kind of hurting our hiring processes. I don't know that people really want to get into law enforcement in the current social environment, which is unfortunate because I think out here in West Bloomfield, we do a fantastic job of partnering with our community, and we enjoy the support of our community. And if there is something that is unfortunate, we're able to sit down with them and resolve things very quickly. So it's been great out here.
So with that, Lieutenant Tilli, we also know that the hiring process is not a quick, easy process. For anyone considering going into law enforcement, what advice do you give them?
Well, I would say the best advice would be to, if you can, put yourself through the academy. But I think education is a premium. Having a bachelor's degree will make you more appealing than having an associate's degree. I think you need to be patient, because we at West Bloomfield here, we do a very thorough background investigation. It takes a good 3 weeks to a month to dive into someone's background to make sure that they're a strong candidate for our agency. So I think those are the key factors. But again, once you're here, I think you'll be happy and well rewarded with training opportunities and different units that you can be involved in. It doesn't just have to be patrol. It's a little bit like they say in high school, the more involved you are, the more you'll enjoy it. And I feel that way about our agency. The more you get involved, the more you'll enjoy it.
Lieutenant Erik Tilli with us here on the Megacast. He's the West Bloomfield Police Department. So can I ask you as well, I used to have the pleasure of doing the recruiting when I worked for ATF, and I will say your background process is so much easier than a federal background process, because they would go back 10 years, come out, talk to your neighbors, a lot of things that they kind of dug into. But one of the other big issues people didn't think about was their credit score and having good credit. Also their interviewing skills. Do those two things play into your process at all?
So we do all of those things. We will speak with your neighbors. We'll do an in-home interview. We will check your credit scores. We'll scrub your social media accounts. I would say that our background is, while the federal one is probably a little more in depth, ours is pretty rigorous.
So with that, now is a good time to clean up your life, and it's okay to have outstanding debt, I would imagine. We all have debt. It's just make sure you're not behind on your payments and things of those natures, because it can be a process. And like you said, just trying to get enough people of a diverse background to want to go into this industry is really challenging right now.
It is indeed. But I think we're going to do okay here in the future. We have a lot to offer, and we want to hire the best people.
So with that, Lieutenant Erik Tilli with us here on the Megacast. He's with the West Bloomfield Police Department. I know that the DEA recently had their big push for people to return their unused medications. I know that you have a similar program all year round, though, don't you?
So we have a prescription drug take back in the front lobby. It's like a mailbox. You can go up and you can put it in a bag and you can just drop it in there. But yeah, April 24th, the DEA prescription take back occurred. And here in West Bloomfield, we collected about 250 pounds of unused prescriptions. Funny enough, I was reading about that. There's a 30-pound limit per person to drop off. I'm not sure who keeps 30 pounds of prescription drugs at their house, but it's a fair sum. So, yeah.
Yeah, we were surprised because we went, but we had so many pet medications. And, a lot of the medications people forget are for our pets are really designed for humans as well. So it's just as important to get rid of those medications as well as those for the humans in your household, because are you worried that throughout this pandemic, so many kids have been, spending more time at home, especially teenagers, because of the pandemic, that having those medications laying around the house, it can be tempting for them to start them down a path of illegal drug use?
Yeah, it's always a concern. I guess being home more makes it a little bit more prevalent, but I think it's always a concern that if there's prescription pills laying around, not in a secure location, not out of reach, that whether intentionally or inadvertently, a child can get involved with that, sure.
Erik Tilli with us here on the Megacast. He's a lieutenant with the West Bloomfield Police Department. Just another minute or two with you here, Lieutenant, before we say goodbye. Anything maybe we didn't touch on that you want to mention for the community as we go into the summer months? One thing we are seeing so much right now, I know I drove through my neighborhood a few weeks ago when it was really nice. How many people leave their garages open while they're around back working in their yard?
So there are some gypsy scammers who will go around, see that your garage is unlocked. They'll send somebody around back to distract you while they'll either try to gain entrance to your unlocked front door or entrance through your garage into your house and take products or items from your house. So just be aware, be cognizant. If somebody comes around back and they're having a completely miscellaneous conversation, I would be curious as to why. I try to keep my house locked up, but my wife does a lot of gardening, so our garage is constantly open. So we'll keep an eye on it, but we know it's something that can occur. But I guess you have to have a balance between the practicality of being outside and enjoying the fresh air and your own safety.
So when you say gypsy scammers, what do you mean by that?
So there's certain groups, I don't know if that's the professional term for them, but they'll go around and travel from state to state. Obviously, in the winter months, people are in their houses, so it's not great to do during the winter months, but they'll travel around from state to state looking for these opportunities where they can go into a neighborhood, send somebody around to the back of the house, distract the homeowner while another party or parties go into another entrance to the house and take valuables. And they'll just travel around. They don't really live in the area. They travel from state to state doing this.
And we all fall victim to this too, because as much as I've been worked in the news, we've done these stories, I still see situations where even we do it in our house, and it's just these habits that are hard to break, but it really does open yourself up. It's crimes of opportunity.
Certainly, absolutely. I mean, you just need to be aware of your surroundings and your area. It's just the same as when you walk out to your car. Don't have your head down on your phone. Keep your eyes up and be alert. It's just being aware of your surroundings, I think, is important as people. Crime does occur, fortunately, out here in West Bloomfield, but it's very rare. We like to keep it that way, but it does occur.
So with that, Lieutenant, too, have you seen an increase or decreases when it comes to some of the, more smaller, I don't want to say petty theft, but, car break-ins or home break-ins, because so many more people are home now because of the pandemic?
Well, I don't have any official numbers, but I feel that I've heard about less home invasions because more people are home. But like the car break-in type of stuff, which usually occurs in the nighttime when people leave their cars unlocked, groups of typically, not always, young folks will go out and do this after dark. Feel like that's very seasonal. It seems to occur right after school gets out, and their parents are no longer making them come go to bed early and stuff like that. It seems to be more seasonal.
So with that too, how much of it seems like everyone in my neighborhood now has some type of Ring camera or doorbell camera. Having those cameras, do they help you in trying to solve some of these crimes?
Absolutely. You'd be surprised the amount of information that we can grab off of those, whether it's someone's face or a description of their vehicle. There's a great tool. While law enforcement we don't have access to them without permission from the homeowners. Typically, when a homeowner's been victimized, they're more than happy to provide that video to us.
Exactly. So Lieutenant Erik Tilli with us here on the Megacast. He's with the West Bloomfield Police Department. We always appreciate talking to all of you. And also, if I could take a moment to say, also, we know this is a Police Appreciation Week. And if we could take just a moment to show our appreciation and say thank you to all of you for all of the work that you do as well.
Thank you very much.
Lieutenant Erik Tilli from the West Bloomfield Police Department. Again, Police Appreciation Week. Take time to just say thanks to the men and women that are serving on the front lines to keep all of us safe. With that, we're going to take a quick break here on the Megacast. When we come back, we'll be talking to the American Red Cross. This is the Megacast.
My grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
We want to say thank you for taking time out of your day to be with us here on the Megacast. I'm Ronnie Dahl here in my home studios. Mr. Tyler Keefe doing a great job as always, holding down things back there at the studio in West Bloomfield. As a reminder, you can always catch us live Monday through Friday, 10 a.m. until noon. Civic Center TV, Birmingham area municipal access. You'll also find us on channel 15 if you have Comcast, 99 on AT&T, and you can listen to us on the radio, 89.3 WBLD, 88.1 WBFH. So we want to say thank you. And of course, you can find us on Facebook as well, civiccentertv.com. For so many people, the American Red Cross, they're there to help us in a disaster, but we don't think about them until the times that we need them. With us now, let's bring in Todd Coleman. He is the communications manager for the Michigan region of the American Red Cross. Todd, always great having you with us. How are you today?
I'm doing great, Ronnie. Thanks for having us on this morning. I appreciate that.
For so many people, I think American Red Cross, we see the commercials and we'll see the signs in the neighborhood. But really, until you've been in the need, in some of the situations, you don't think about what the American Red Cross does each and every day. Give us an overview of your organization.
Well, we serve all the communities that we are present in a variety of ways, Ronnie. You had mentioned disasters. For instance, here in Michigan, we've had a very active home fire season over the past year. So we are on the ground and we are assisting those folks who may be in an apartment complex or maybe just a single family residence that may have been having to flee from their homes due to a fire. So we do provide support at the scene. We will provide shelter, food and water. We also can provide mental health services for those who may request it, and also can help them with the paperwork and the guidance necessary for them to find a new place to live if that's the situation. Blood collection is another big part of the American Red Cross. We collect blood throughout the United States. Of course, we do here in Michigan as well, and that includes platelets as well. And the need for blood is constant, and that's something we always want to push out there. Every 2 seconds, somebody in the U.S. needs a blood transfusion. So it's the blood that's on the shelves now that helps in the event of an emergency later. As we head into the summer months, typically it's a challenging time for the American Red Cross to collect blood donations, and that's for a variety of reasons. Folks are enjoying this great Michigan weather in the summertime. Maybe they're heading up north, vacations, family get-togethers, that sort of thing. So oftentimes blood donation will kind of take a back seat to those summertime activities. And as you know, we've been in a pandemic for the past 14 months, and we're finally getting back to some normalcy. Vaccinations are rolling out, and we're people scheduling those appointments to be vaccinated. And so right now we're a little concerned about the impact that summer travel, that sort of thing, resuming normal activities during the summertime, how that may impact the blood supply as we head into the summertime. So at this point right now, we are certainly encouraging those folks who are eligible to schedule an appointment to donate, take that 1 hour out of your day and help save lives. Those are the two, high-profile things the Red Cross would do in a community. But we also offer training, CPR training. We have babysitter training, lifeguard training, that sort of thing. Also, we serve our armed forces. We have services of the armed forces where we assist families and military members in a variety of ways, be it a phone call, be it getting them letters or just getting them news on what's happening here in the United States if they are indeed overseas. So as you can see, we do serve the communities in a variety of ways, and it's all about our humanitarian effort that we do these things.
And we should point out that you do so much of that with the help of volunteers.
Yeah, we couldn't do our job without volunteers. I mean, they make up about 90% of our humanitarian effort, and there are always volunteer opportunities out there. And we encourage folks who maybe if they can't donate blood, maybe if they can't make a financial donation, they can help and volunteer in other ways. Be it work at a blood drive, work the snack table, hand out juice to the blood donors after they get off the bed. We also have folks who actually will pick up and deliver some of our blood products to the hospitals that we serve. They could very well just be signing in folks at a blood drive, also assisting with our disaster relief operations in a number of ways. So we encourage folks to get involved if that's something that they're interested in. And again, it doesn't have to be a blood donation or a financial donation. It can be just as much as donating your time.
So with that, Todd, one thing that you mentioned, I'm curious about, how has the entire pandemic, when it comes to the blood supply and the need, changed throughout this entire pandemic? Because we do know in the beginning of the crisis, people were not driving as much, so maybe we didn't have as many car accidents. People were not having surgeries as much. Did that impact your blood levels? And now do you anticipate it's going to get back to pre-pandemic numbers with the return of, we hope, normal?
Yeah, when this pandemic hit, Ronnie, back in March of last year, I mean, it was new for everybody, and the Red Cross is included in that. We had to make a lot of changes to the way we operate and to the type of information that we were getting out to the public regarding blood donation. Obviously, as you mentioned, folks were a little nervous to maybe go out and drive around, and that, of course, impacted our blood drives because folks didn't want to gather where there were other people. And so it was ours from the get-go was to get the information out there that we put safety as a priority for all our blood drives, all of our blood donation centers. And we implemented a lot of safety precautions at every drive almost immediately when the pandemic hit. Things like checking the temperature of staff and blood donors before they come into the blood drive. Hand sanitizer stations throughout the blood drives for sure. Social distancing on the beds and when they're in the waiting area before they make that donation. And of course, face masks. We want people to wear face masks in our blood drives. That's including our staff. And if they don't have one, we certainly can provide one for them. So it was a little bit of a challenge, but we understood folks were a little concerned. So we made it a point to get that messaging out there that it is safe to donate. We've been working with the Michigan Department of Health and Human Services from the get-go to get that messaging out there that blood donation is critical to our communities. And even Governor Whitmer has donated a number of times during the pandemic to show that it is safe and we are following all those precautions. So our donor base has been fantastic. They have been coming out in droves since this pandemic began, and they were able to allow us to keep a healthy blood supply for those hospitals and patients that need it most.
So how is the supply level right now?
We're at adequate levels right now, but again, as we start heading into the summer months, we are seeing, we do a lot of blood drives at schools and at universities and colleges. And as you know, students are either working remotely or they'll be leaving campus very, very soon. So a lot of those blood drives may come off the books until fall again. So those opportunities are kind of lost. So it's even more important for those donors to find those blood donation opportunities in their community that do continue throughout the summertime. Because I mentioned, folks use a lot of vacation time during the summer. Students are away from classes, and we need every precious pint of blood that we can collect over summertime.
Todd Coleman with us here on the Megacast. He's the communications manager for the Michigan region of the American Red Cross. And I would think as well, could it be a good sign for the American Red Cross hearing that offices are going to be able to start bringing employees back? Because I would think that you do a lot of blood drives at businesses as well.
Yeah, that was a real challenge for a good portion of the last year as well, Ronnie. We've, a lot of businesses working remotely, not letting anybody on their work campus, and that, of course, would affect whether or not we could continue hosting blood drives on those campuses. our sponsors are very, very important to us. The businesses, the community centers, the churches that host these drives regularly, VFW halls throughout the state of Michigan as well. So we did. It was a real challenge to pick up those new sponsors who, again, much like our donors, were maybe a little bit leery about bringing in a blood drive into their place of business. But they've stepped up, and new blood drive sponsors have stepped up as well and joined forces with us to provide those opportunities for blood donors.
So, Todd, what is the process? Do you actually test the blood? Because we do know one thing about COVID-19. So many times people are asymptomatic. They don't know if they have COVID-19.
Yeah, well, we've been testing the blood donations for COVID-19 antibodies since last April. And that was a point where we were encouraging convalescent plasma donations, which, as you may know, was used to help those folks who were currently battling COVID, maybe in a hospital. That was used to make them feel better, basically. So, we are still testing all blood donations for antibodies, and especially those that may have high levels of those antibodies. They can still be utilized for convalescent plasma to help those folks who are battling COVID-19. As far as the actual blood testing, we test all of our blood products. They're collected at our donation centers, at the blood drives, taken to a testing facility, deemed safe, and then distributed to the hospitals that we serve.
Yeah, it's funny because, at the beginning of this, I remember there was so much of a conversation prior to the vaccine about the need for the plasma, but we're really not hearing much about that right now as well. So is it still needed and used?
Yeah, it is still needed and still used. And we had folks who, we had a lot of people come out to donate nationwide as far as the convalescent plasma. And again, those would be those folks who, tested positive for the antibodies. They had high enough levels to be able to come back with the American Red Cross and actually just make a convalescent plasma donation. However, right now we're testing all blood donations for those antibodies. And again, those with high levels may be used as convalescent plasma to meet future needs for those patients.
We're talking with Todd Coleman. He's the communications manager for the Michigan region of the American Red Cross. And with that, Todd, how do people find out about some of the upcoming donation drives? Because they're not so widely advertised right now. We used to see them, on the side of the streets, at big facilities. Where are they tend to be happening right now?
Yeah, the best place for your viewers and listeners to find a blood donation opportunity is to go to our website, and that's redcrossblood.org. You can type in your zip code, and you can find a radius, if you will, a number of miles, however you determine that, as far as what blood drives are coming up. You can also make that blood donation appointment right on our website as well. We have a Red Cross blood donor app, and that's for a smartphone. It's a free download from that same website, redcrossblood.org. And again, it's a great resource to find open blood drives, schedule that appointment to donate. With the blood app, you can actually track your donations. You can challenge friends to donate and that sort of thing. And we say it puts the power to save lives right in the palm of your hand. And it's been a very, very popular application for smartphones. And then there's the old-fashioned way. If folks maybe aren't as computer savvy or smartphone savvy, they can use the telephone and call 1-800-RED Cross to make an appointment.
So with that, Todd, we know that the Red Cross is also a nonprofit. How are fundraising events going right now? A little challenging.
Yeah, it's been a little challenging, much like your job there, Ronnie. It's been a lot of remote type activity. We did do a lot with our marches, Red Cross Month. We also had a Heroes of March event in the Metro Detroit area. A lot of that was virtual. Obviously, all of our meetings are virtual. All of our interviews are virtual. But we've been plugging along. We are currently doing our Sound the Alarm campaign, which involves us encouraging folks to have a home fire escape plan and to make sure that they have working smoke detectors in their homes, and they're testing those smoke detectors monthly. Now, in a typical year, we would be out and about doing a lot of home visits, installing those for them, but things have been a little bit different now. We're still making those available to residents throughout communities, but we had to kind of get a little more creative in the way that we do those type of things. So we're real excited to be able to get back to some normalcy. A lot of our volunteers to maybe respond to like a disaster or something along those lines have found it a bit challenging and a little bit different because they're used to that face-to-face contact, be it speaking with someone who was affected by a home fire, comforting that person, that sort of thing. But a lot of it is done by phone or by a Skype or a Zoom or something along those lines. So it's all been challenging, but we've come through, as I think most of the United States has. We find ways to adapt, and I think that's the important thing, so we can continue our humanitarian mission.
So with that, Todd, too, any silver linings that maybe the Red Cross has discovered throughout the pandemic that you'll keep post-pandemic?
That's a really good question, Ronnie. I think our mission has always been the same, pre-pandemic and current pandemic, and even post-pandemic. I think, I think we're all excited to get back and to see those folks that we work with, to see those volunteers, to see those folks that we help. Home fire victims of flooding, that sort of thing. And I've spent a lot of time at blood drives throughout my nearly 9 years at the Red Cross. And I've met a lot of blood donors, a lot of blood recipients, and that's kind of taken a little bit of a backseat. I don't get that one-on-one. And I think that's just what we're all kind of looking forward to. And I look forward to that day when we get that normalcy back, where we can start, being face to face with these folks, because it really is heartwarming to meet these people, talk to them about their blood donation story. Maybe they received blood at one time in their life. Maybe they were affected by a home fire and now they're volunteering because the Red Cross did so much for them. So I think that's kind of what we're looking for.
And do you find that is often the case, Todd? People received something from the Red Cross in some of these critical moments in their lives, and so they realize the value of what you do and what you offer, so therefore they feel the need to give back.
Yeah, I think that's not uncommon with blood donation, especially. That's something I always ask a blood donor or a platelet donor. I always ask them, what made you start donating blood? And it may have been a family member or a relative or that individual themselves that at one time needed blood products. Maybe they were in a horrific car crash. Maybe they had an organ transplant, which both those procedures utilize lots and lots of blood units. So they were impacted somehow by the American Red Cross, and they feel it's something they want to do as far as giving back and helping others, just like they received that help.
Todd Coleman with us here on the Megacast. He's the communications manager for the Michigan region of the American Red Cross. And with that, Todd, anything maybe I didn't touch on that you want to share before we let you go today?
Yeah, we've got a really neat donor incentive going on throughout the month of May. For all those folks who come out to donate blood or platelets during the month of May, they'll be automatically entered to win a travel trailer camper, and that's powered by Suburban Propane. It's a Coachman Clipper travel camper, sleeps 5, ready to take friends out during the summer, and that's a really, really neat incentive, which we like to offer to our donors as a thank you, if you will, to coming out, donating, and helping save lives. But once again, 1-800-RED-CROSS is the phone number. You can go to redcrossblood.org, or you can get that Red Cross Blood Donor app, again, for your smartphone, and keep up on all the things blood-related, emergency-related, that sort of thing.
Well, Todd, we want to say thank you for your time, but also thank you for so much that you and your team do, and the volunteers as well for our community. I've been to so many fires and floods here in the region, and the American Red Cross always there on the front lines. So thank you to you and your teams. And we should note volunteers, I would imagine, Todd, are still always needed as well.
Volunteers are always needed, and I can't say enough about our volunteer base. Again, we couldn't do what we do without them. So big kudos to them, and thank you very much, Ronnie, for having us on to talk this morning. I do appreciate that.
Anytime. Again, you're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. We'll take a quick break here on the Megacast. When we come back, still a lot to get to in the second hour of the show. And right after the break, we'll be speaking with the Chancellor for the Oakland Community College. That's next here on the Megacast.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Taking time out of your day to be with us here on the Megacast. As a reminder, Tyler and I are here Monday through Friday, 10 a.m. until noon live. And you can always catch us, Civic Center TV, Birmingham area municipal access. You'll find us on channel 15 if you have Comcast, 99 on AT&T. You can also listen to us on the radio if you're out driving around, 89.3 Lakes FM, 88.1 FM The Biff. And then to make it even easier for you, you can go to Facebook and find us live streaming the edition of the Megacast on our Facebook page. But just in case you missed the show or an interview, you can always find the previous episodes on civiccentertv.com. Starting off the second hour, right now is such a great time for people to take advantage of trying to, renew their skills and get new skills by going to a community college. There are so many programs reaching out to, especially those that are lower income here in our area, for them to get a better future. To talk a little bit more, let's bring in Peter Provenzano. You're the Chancellor for the Oakland Community College. How are you?
I'm doing great, Ronnie and Tyler. It's been a few months since we last talked. You guys are looking great. I'm sure you're obviously getting used to the new Zoom, the Zoom world.
We all are, aren't we?
Yeah. Yep.
I really wish I had a crystal ball and had stock in Zoom prior to the pandemic, because I'd never even heard of it.
I know, it's amazing. I remember the first time I had my first Zoom meeting was over a year ago. And we would have it from time to time, but I thought, my goodness, I need to learn this because I'm probably going to be doing it for another couple of weeks. Little did I know it would be over a year. So
we've all become Zoom experts.
Yes.
And with that, Chancellor, if we can ask you, how are things going at the community college? Are you guys back in person yet?
No, we're still mostly remote. We have some hybrid classes and face-to-face classes for the labs and a lot of the hands-on learning. As you know, we do a lot of skilled trades training and, from culinary to welding and robotics. And so they've been meeting in a hybrid format, but we've been mostly remote for the pandemic. It's really just simply been the best way to keep everybody safe and on track with their academic journey. But we are anticipating as vaccines continue to roll out, there's a lot of optimism out there. We are beginning to plan for a potential return to class, return to work this fall. So we've got a task force that's meeting on a regular basis to discuss what that would look like.
So with that, Chancellor, too, do you anticipate, though, that some type of hybrid model will still be offered post-pandemic?
That's one of the really exciting things. And you were talking to your previous guest about the silver lining about the pandemic. And I think there are silver linings. And at OCC, the silver lining is that we have learned to provide, programming and student services in an online format, which is really exciting because it provides more flexibility for our students. So yes, I do believe that we will continue. I know we're going to have more online classes, but I also believe that we're going to continue to have more and more student services online, hybrid, which is a combination of both, but also offer a lot of face-to-face classes. And so the point is that we've learned ways to be more flexible for our students, which is really, really a benefit for them.
How is enrollment right now?
Enrollment's been good. At Oakland Community College, we have done, we just have an awesome team. Our enrollments, despite the pandemic, has been pretty steady throughout the pandemic. Every semester, we have been up a few percent or so. And that is, again, I credit the entire team, the ability to pivot and move to an online learning environment. And that really is in comparison to a lot of other community colleges and universities who are seeing double-digit declines. And so we've been fortunate.
Some of the students, are they students that maybe would be going to a 4-year university, but really, why am I paying the extra tuition if I'm remote learning at home here locally?
We've had, especially during our summer months, we have a pretty large, what we call guest student population that are, they're coming home from Michigan State University, University of Michigan, other universities, and they take classes during the summer at OCC. And we saw a lot of that happening this summer as well as last summer because of the pandemic, because they really were looking at this saying, well, here's an opportunity to have a high quality education at a fraction of the cost at OCC. And so we are seeing an uptick in that.
Right. We're speaking with the Chancellor at Oakland Community College, Chancellor Provenzano. And with that, I have to say I was on the website looking at the cost per credit. Yeah. It is astounding to me, by the way. So really, when you're looking at this, you're wondering why more parents aren't doing this or more students aren't doing this, because we do know a lot of these credits can transfer now as well.
You're exactly right. And so we are blessed to have one of the lowest in-district tuition rates of any community college in the state of Michigan. But also that was really what community colleges were designed for. Oakland Community College, Oakland County, there's a tax millage that helps to subsidize and bring the cost of education down to really make it more accessible to all students. And so we're trying to get the word out prior to the pandemic, even during the pandemic, and it'll continue post-pandemic, about the incredible value of a college degree at a community college, because it leads to, so we say there's so many pathways to success. There are so many degrees, credentials that we have that lead to a job, a high-paying job, a high-in-demand job right away after maybe just a year of or less of schooling and training. Or 50% of our students transfer to a university. We're the largest transfer institution in the state of Michigan. And so that's something else that we're very proud of. So it's a way to bring the cost of education of a 4-year degree way down. It's really like a built-in scholarship when you think about coming to OCC first and then transferring to a university.
So if I can ask you, do you anticipate that enrollment is going to be going up? Because we do have some of these programs right now that are being pushed through the state, focus on some of the trades, but also our frontline workers. Are you seeing anyone take advantage of this program yet?
I sure hope so. I sure hope to see enrollment go up, mostly because we are part of an initiative called Oakland 80 by 30. And so the goal is by 2030, we would like to see 80% of working adults in Oakland County have a degree or credential. And why this is important is we know that it leads to an enhanced standard of living and makes, with training, it allows you to be more employable. But we also know that it's better for the entire region, for the entire county, because employers come and they locate where the talent is. And so it's critical that we bring more and more of our residents and students through the educational system so that we can all, as a community, be more prosperous. And so I hope that residents take advantage of all of these incredible programs. There's never been a better time to come to a community college. For example, most recently, we had the governor announce the Futures for Frontliners program, where if you are a frontline worker, you're able to attend community college for free. There's also Michigan Reconnect, which is something that was recently rolled out by the state of Michigan, which essentially gives free community college tuition to working adults. And most recently, President Biden rolled out his plan, which is really a nationwide plan, to provide free community college tuition, which is really exciting because it's really the first plan that we've seen in a long time that not only focuses on the financial hurdles in providing free community college tuition, but it offers a tremendous amount of funding for what we refer to as the wraparound services that are so critical to student success. Because what we've learned over the years is that financial hurdles are just one hurdle, but there are so many other barriers that get in the way that need to be funded. And Biden's plan appears to do that. For example, funding, help for mental health, transportation, counseling, but it just really the basic emergency needs that students have that get in the way. Life gets in the way of our students. And it was interesting. There was just a recent study. There was an article in the Detroit News about the Detroit Promise, which is just a marvelous program where Detroit students have the ability to go to a community college for free, including Oakland Community College. And they did a study over 10 years, and there's so many students that never graduate, despite the fact that they have free college, because life gets in the way. And so it's so important that we focus on funding and providing those wraparound students so that they can persist and complete.
Yeah, transportation you mentioned as well, and we know for so many people it's childcare.
Yes, and childcare. I failed to mention that. That is a huge burden on not only working adults, with their jobs, but students as well.
And I will say, when we hear this word free, it's not free, it's funded by taxpayers. So, but there is reason why we should support, because we're lifting everyone up, which lifts the community up. And with this, do you think that some of these programs and the talk now around the need for so many skilled trade workers is going to shift the conversation in America? Because I feel like we went from skilled trades to pushing that 4-year college degree. And now we're getting back to skilled trades because we know that there is such a desperate shortage across the United States. But a lot of the skilled trade jobs pay more than jobs with 4-year degrees.
I sure hope it does help change that conversation, because I agree with you that the pendulum has swung the pendulum tends to swing too far towards skilled trades or towards a 4-year degree. The reality is we need both. We need talent out there that has a 4-year degree or a master's degree or a certificate. We need all of that. And so I think it's important to keep that balance. So I'm hoping that all of these, the free community college tuition sparks that conversation, that it's important to find a pathway to prosperity. And that it really starts with an education. It really starts with some form of training. And one of the things we're trying to get the word out is that, you can come to OCC and take, here's a very, successful pathway. You take a program that might be a 1-year certificate. You graduate with a welding certificate. You're making, $50,000, $60,000 a year, but that may not be the end. Years later, you may take what you learned at OCC and transfer to university and get your bachelor's degree. And now you're managing people, and you continue to work your way up at the corporation. So there are so many different pathways with on-ramps and off-ramps on your educational journey. And so that's one of the other things that is really great about the conversation about free community college tuition. You're right, nothing's free. It's funded by the taxpayers, but it does start that conversation and hopefully plants the seeds in a lot of minds that there are these pathways that already exist. But the reality is, too, the exciting thing is we don't have to wait for, Biden's proposal to be approved. Again, there are so many pathways that are free to our students right now. You don't have to wait. So there are Pell Grants, there are federal financial aid. There's millions of dollars of scholarships, Ronnie, that are just sitting on the table waiting for students to apply. And so we're trying to get the word out that there are avenues already to dramatically reduce the cost of tuition, including going to a community college. You don't have to wait.
And so with that, Chancellor, do you find, especially when we're looking at older adults going back to school, maybe they're 25, 30, 35, could one of the hurdles, them trying to get transcripts, just those little steps of trying to get back into school, what are the hurdles that you're hearing?
Little things like transcripts, testing. So we're doing a lot of work around helping students become college ready, prepare them for college level math, college level English. We're providing tutoring, counseling, intensive counseling, all of those support services to help a student come back. Because especially if you've been out of school for a little while, it's really hard to come back, take that. I wouldn't pass I probably wouldn't be able to pass the math test. But the key here is that with some tutoring, a little bit of coaching, you can get up to speed and be wildly successful in college. And so we're trying to get the word out that the support services are there to help make you successful. One of the things that we say a lot around OCC is, our goal is to make student success unavoidable. And that's something that we're really passionate about. And so if that's something that a resident or a potential student's a little apprehensive about, well, we've got you. Together we can do this.
So what do you see as some of the most popular programs for students to go into right now?
It really runs the gamut. What the areas that are really hot are the skilled trades, so our welding, those classes book up very, very quickly, robotics, CNC machining, we do a ton of work, and a lot of training in that. But we also, because I said we're the largest transfer institution, a lot of what we refer to as the liberal arts areas, like math, science, English, very, very popular. And students are taking those and they're transferring to universities. In fact, science, we have a brand new science building that is well underway. We're hoping to do a ribbon cutting ceremony this fall at our Auburn Hills campus. And so that's very exciting. And that's going to have all of our, a lot of biology labs, chemistry labs, and a new CIS lab, which, by the way, is very, very popular. And then police academy, fire academy, those are in very, very high demand. Our cadets, there's nothing more wonderful than watching our police academy and fire academy graduate. We do a wonderful ceremony, and you see almost all of them have jobs at local police departments. Nursing is another one. All of our nurses practically all of our nurses in our program have a job, and they're hired right out of college.
And we know nursing school can be very difficult to get into. So this is a good way to kind of get ahead of the game, per se, if you want to transfer into one of the 4-year programs. And I will say, I was lucky enough, I went to college in Charleston, but they had a program where you paid C of C tuition, but you could go to the community college because it was hard to get into some of the classes. Let me tell you, students, if you're listening, take your foreign languages, take your math, your English at the community college, transfer it over. You'll be so much happier. So with that, Chancellor, before we let you go, do you guys have a deadline right now as to when students can apply for the summer courses?
Right now, we've already started summer courses. We do have some summer late start courses that start in July. If you visit our website, you'll be able to go on and register for courses, and we'll walk you through. It's a very easy step-by-step process to register, but we're already starting to gear up for the fall. So we'll be making an announcement in the next few weeks as far as what the fall schedule will look like. And registration for that really begins early July. And so we're really very excited to try to bring everybody back face-to-face as soon as we can. It's all about getting the vaccines. And so we're really encouraging people to obviously it's their decision, but to get a vaccine because it just makes it easier to keep everybody safe.
So before we let you go too, how are you doing when it comes to the side of professors? Because we know so many of the schools, when it comes to high schools, elementary schools, there is such a teacher shortage out there right now. Is that still transferring over into the community college world or no?
It is, especially, and we talked about the skilled trades area, because oftentimes in robotics and CNC machining and welding, there's such a high demand for them in the industry, and there's so much overtime for them. They're making so much money that it's hard for them to come back and teach. But what we're seeing is a lot of them wanting to give back and come back to train the next generation because they realize what an amazing career they've had. And it all started at OCC, and so they want to give back. And so we're seeing more and more of that. So we'd love to encourage more and more of the tradespeople to come back and help us prepare the next generation.
Chancellor Provenzano with us here on the Megacast. He's with Oakland Community College. Chancellor, anything maybe I didn't touch on that you want to add before we let you go?
No, I think you covered a lot of ground. I would just simply say, and you really started your program saying there's never been a better time to register at a community college with all of the support services and the free tuition programs that are out there. There's never been a better time.
That is so true. Take advantage of these opportunities. It's one of the things that makes our community so great. Chancellor, again, we always appreciate your time, and good luck to you and your team this summer and the upcoming season as well.
Thank you, Ronnie. It's always a pleasure.
We're going to take a quick break here on the Megacast.
Finally, I just got my COVID-19 vaccine.
I registered with my local health department and they called me.
I got mine at the pharmacy, and my neighbor got hers from the hospital.
I'm not a techie person, so I called the COVID hotline, and they helped me schedule an appointment.
Get vaccinated with the first vaccine you can. Protect us all.
Learn more at michigan.gov/COVID vaccine. COVID-19 has caused many families to fall behind on finances and on groceries, but you're not alone. You shouldn't have to worry about putting food on the table. MyBridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
Time out of your Tuesday to be with us here on the Megacast. Tyler, I had to sit here and think for a minute. What day is it? It's only Tuesday.
I know, it's only Tuesday. It's crazy. It feels like it's been at least half a week already, and we're only through really one day. It's wild.
It really is. But we always appreciate you taking time out of your day to be with us here on the Megacast. About 40 minutes left here in the show. And next we're going to shift the conversation just a little bit and bring in Marie Ragone. She is the owner for the West Bloomfield Lifestyles Magazine. Maria, thank you so much for being with us.
Thanks for having me.
Can I ask, what has it been like to try to publish a magazine in the middle of a pandemic?
Oh man, it's been kind of crazy. So we actually launched our first publication in February 2020. So right before everything shut down. And so our first issue was February, and then we had a baby March 5th. So it's been a crazy year for us, but we're blessed.
But are you sitting here going, how do I wake up and do it each and every day?
Yeah, it's been difficult. You know, when everything started to shut down in March and April, we had a lot of our clients just kind of, for lack of better words, freak out. They didn't know what was going to happen. And, you know, they didn't know what was going to happen with their business. So we were able to work with them and keep them as our clients and still continue to give some good news to our community through our magazine. And then hopefully help some of those businesses as well.
So with that, Maria, if we can kind of start back, what made you want to even publish this magazine?
So my husband and I are actually from West Bloomfield, and we grew up there. We love our community. We love hanging out there, and we just love how beautiful it is. And I was actually working at an automotive seating company and got laid off. And it was kind of a blessing in disguise because I was really looking to shift my career so that I could focus more on my community and have a little bit more family time. You know, engineering world is pretty demanding, especially having little kids and everything. So we were looking for some opportunities where I could have my own business. And my husband, Russ, and I, we're like serial entrepreneurs. We've always had side businesses and we're hustlers. So this magazine opportunity came across my lap, and we decided to go for it. And he's actually part of my team, so he and I launched the publication together, and it has definitely allowed us to have more family time, more time with our community. It's allowed us to connect with the community, and we just love it.
And so for those that don't know, the Lifestyles Magazine, it really is about promoting the people and the businesses here in the West Bloomfield community.
Yes, it's definitely all about what makes West Bloomfield a great place to live and work. We focus on community articles, recipes, calendar of events, and good news that's around the community.
So, and one of those things about, the community, it's about also getting out and going to events and networking and finding new clients and finding new people. But then the world shut down. How many publications did you have in place at the time of the shutdown?
Just one.
Just one. So you were like panicking a little bit.
Yeah, we might have had our second one hit mailboxes around the time that everything started shutting down.
So at that point in time, let's say we're March, April, because think back to the beginning, right? We thought it was going to be 2 weeks, flatten the curve.
Yeah.
So you're like, oh, we can handle that.
Yeah.
But then it drags on. How did you continue to keep the magazine afloat during, let's say, April, May, June?
Well, we definitely worked with our editor, Danielle Alexander. She's a very talented writer, and she was able to use her skills and she really knows a lot of people, and be able to write some great articles for us, involve the community in that way. And then we also did some articles about some of our business partners and our clients, just to help them and encourage people to go out to dinner and support our local restaurants, and just as much as possible try to reach the community and help them any way that we could.
So it's one thing to be able to write the articles and to interview people via Zoom, over the phone. We've all become so accustomed to that. But what's it been like for photography and for that side of the house?
Well, our photographer, Joseph Leese, he's very talented as well and very professional. He always goes and wears masks, and being a photographer, you can kind of keep your distance a little bit. You don't have to get really close to somebody. So it's worked out okay. And yeah, I mean, most of the shoots have been far away enough to keep social distance guidelines.
So with that, when it comes to actually laying out the magazine, do you do that in a team, or has that been virtual as well?
So our magazine is actually part of a franchise of lifestyle publications, and they've been around for almost 12 years now. And there's a big team in Kansas City that does all of the layout for us. And then they also have ad design for us as well. But we're responsible for submitting the articles already written and our business relationships here in West Bloomfield. So thank goodness we have a big team.
So with that, we're speaking with Maria Ragone. She's the owner for the West Bloomfield Lifestyles Magazine. And Maria, what silver lining do you think has come out of this pandemic for you and your team that maybe you wouldn't have developed had the pandemic not happened?
I think we've definitely learned to communicate more with some of our clients and our community and reach out, because we really need to ask, what's it like for you right now and how can we help you? So that's helped us just in communication.
And with that, has it been somewhat of a lifeline for some of the businesses as well to be able to tell their stories in a different way?
Yeah, I think so. It's, there isn't a lot of opportunity to be published in media. So when you partner with us, that's just one of the benefits of having a story written about you, not only in print, but we're also online too. So that's easy for them to share.
Yeah, this world is definitely changing. The media landscape is changing. And what has it been like to be able to balance the world of print versus digital?
It's kind of difficult, because a lot of people think that print is dying, but it really isn't. People just love picking up books over Kindle sometimes. They love the smell of print. And there's a whole demographic that just really likes to have this coffee table style magazine where they can pick it up and really flip through it, turn off their phone. They're not distracted by ads popping up or, dings from social media that somebody's tagging them or whatnot. So, it is difficult when it comes to marketing because digital marketing it's big right now. But really our publication goes into the hands of people in the community. So what better way to get your message out about your business than the people that live right there in your community?
We're talking with Maria Ragone. She's the owner for the West Bloomfield Lifestyles Magazine. And with that, is your magazine subscription based?
No, it's actually directly mailed to select homes and businesses in West Bloomfield.
How do you figure out who gets it? Is it basically by zip code?
Yeah, we selected about half of the zip codes in West Bloomfield. So it just goes to homes, single family homes. It actually doesn't go to apartments or condos. So a lot of our businesses that we work with try to target their marketing materials towards people who own homes.
So with this, I know that in the middle of this, you also are writing a children's book. Do you want to tell us about that?
Yeah, I told you before that we're serial entrepreneurs, so we just can't do one thing at a time.
Oh yeah, like starting a new magazine, having a child, that's not enough. You have to bring on another project.
Yeah, and have a 3-year-old too. So I've been thinking about writing a children's book for a long time. I actually used to write a lot in high school and college, and I had some ideas that I wrote down and emailed to myself several years ago, and then just life happens and didn't do anything with those ideas. And recently, a few months ago, like the turn of 2021, it kind of inspired me in a very interesting way, at least to me. I was reading one of my favorite books and one of my daughter's favorite books, Dragons Love Tacos. And I was just feeling like, man, I need to start writing my ideas again. I need to start working on that. And then the very next day, I was looking through my emails, like in the search box, and I typed in something that was completely unrelated to book ideas, but there was my email that I had written to myself 3 or 4 years ago that was titled Book Ideas. So I took that as a sign from God or the universe or whoever, but that voice spoke to me, and it said, this is time to start writing your book again. And I picked up those ideas and just wasn't really inspired by them. But then my daughter was dancing around and she was like, Mama, I want to wear another dress. And she just loves dresses, and she will wear 3 or 4 of them at a time, like on top of each other sometimes. So I said, Angela, you cannot wear 20 dresses at a time. And that was the idea for my debut children's book. So it's called Nina's 20 Dresses.
So look at that, from an engineer to a magazine publisher to now a children's author. What advice would you give to other people?
I would say, you have to just go with what your heart feels. If you feel like being an engineer one day, do it. I don't even have an engineering degree. I just had a great opportunity and was hired by an amazing company. And I took it. And then, that didn't work out. Like I said, I got laid off. And so you just gotta, I think, follow your heart. If you have an idea, You just got to put it down and go for it. Stop procrastinating.
Right? Because so many people, you have the thought of what you may want to do, but getting it from your mind into a reality, that's where the challenge can lie.
Yes, I think it's definitely, it makes sense to really write down your ideas and just think about them whenever you can, because sometimes inspiration can hit at the oddest moment.
So with that, Maria, how can people find out more about the book, but also the magazine?
So our magazine is available online at citylifestyle.com/West Bloomfield. And you can find out more about my book at mariaragone.com.
Well, Maria, we so appreciate your time, and we wish you continued success as well, even post-pandemic. So hopefully the lessons, you seem to have, taken on the challenges of the pandemic and thrived throughout this time.
Yes, thank you. I really appreciate you guys having me.
It's been great talking to you again, Maria Ragone with us. She's the owner for the West Bloomfield Lifestyles Magazine. We'll take a quick break here on the Megacast, and when we come back, the mayor for the city of Troy will be with us on the show.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Right now, our country feels divided, but there's a place where people are coming together.
I was nervous to talk to someone so different than me.
Me too. Love Has No Labels and One Small Step are helping people with different political views, beliefs, and experiences connect through conversation, and it feels good.
This conversation gives me hope.
It gives me a lot of hope, too. Take a step toward bringing our country and your community together. Start a conversation at lovehasnolabels.com/one small step. A message from StoryCorps, Love Has No Labels, and the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine. Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. We are all looking forward to the day that the pandemic is behind us. But hey, Tyler, I have to ask you, what's going to happen to the show?
I don't know. It'll probably still be around. After the show. It probably will be. It probably won't be as intensive as this. I don't know. I can't see the future. I don't know what the plans are, what the cable commission, what our general manager Dave Scott's going to want of it after the pandemic is over. But I'm sure it'll still be here. That's in some way.
So, of course, so many people know this show actually started out of the pandemic. Tyler and Dave Scott thought it was going to be just 2 weeks. 2 weeks turned into a month. The month turned into 2, 3, 6, and here we are more than a year later, and the Megacast still going strong. And that's because there's still so much to talk about because it's evolving. Things continue to change. And with that, let's bring in Ethan Baker. He's the mayor for the fine city of Troy. Mr. Mayor, great to have you with us.
Hey, I'm excited as always to be here, Ronnie. Good to see you. And you too, Tyler. I don't think you were on last time I was here, Tyler. So nice to see you again.
So with that too, Mr. Mayor, how do things look right now for the city of Troy? It's been one of those days. I've only had one cup of coffee.
Well, I'll tell you about Troy. I can tell you about Taylor too if you want, but not as well as I could about Troy.
They're all close.
Fun fact, Stephen Ewan, who was the actor who was nominated for the Academy Award, he lived both in Taylor and Troy. So we do have that commonality there. But
see, look at that. And for some reason, every day my Google says, when I say, hey, Google, oops, sorry.
Oh, no.
What's the temperature? She always says the temperature in Taylor is. And I'm like, well, I don't live in Taylor.
It's a conspiracy.
Taylor's got some secret stuff going on. I don't know what's going on. They're calling the world.
We've been tailored.
There you go. But with that, though, we do know there are a lot of differences between Taylor and the city of Troy. I was in Somerset. It was pretty busy.
Yeah, it's been definitely, people are out shopping. I notice, I think every day it seems like there's more and more traffic back on our city streets, which usually is bad news, but I'm taking it as good news now. It means people are feeling safe and they're out and about spending money in our city. They're working in our community. And, it's been a slow evolution, I think, to get to where we are. But the city of Troy is doing really well. I told you before, we were well positioned going into the pandemic, which means that we're going to be well positioned coming out of it. We face our struggles like everybody, but I'm really hopeful and positive about where we're going.
So we know the good thing about your budget is it's really based on, the real estate market, which is super hot right now. But the other downside of this, when you drive down the street, so many businesses have closed. I used to get my eyebrows done there. I go, boom, it's empty. The nail place, it's empty. And all of those have a collective impact on a community. How long do you think it's going to take to get some of these smaller businesses back to the area and doors reopened?
Well, I think the big issue for Troy is so much of our daily retail and that kind of small service-based business is based on our daytime population, which practically doubles during a normal work week in non-COVID times, right? We have another 80, 90,000 people that come into our city to fill our office buildings. And when those people aren't in their offices every day, there's just not the volume of people to go into those places to get their eyebrows done or the dry cleaners, some of the smaller restaurants. So my best answer is when we get back to some more return to work type policies and we have people coming in and out of their office buildings again, we're going to have those same people then providing the need and the demand for the small businesses again. So that's kind of where I look at it. We hit a vaccine milestone yesterday in the state of Michigan, which says, okay, 2 weeks from now, people can go back to their office buildings. Doesn't mean they have to or they're all going to, but it's okay from a state health department level to do that. I think you'll start to see more people coming back into offices in Troy. And then soon there's going to be, hey, I need that small business again. I need that retail establishment to be there for me. And they'll be back. It's tough. The worst part, I think, of this pandemic, aside from the loss of life and watching people and love get very sick, is watching people lose everything they have with their businesses and just not being able to make it, no matter what kind of help has come from the government.
Yeah, and we do know that Oakland County right now has a task force with people from various entities throughout the county to try to talk about how to disperse the new $244 million that's coming here to the county to help some of these businesses, which, can seem like a lot of money. But if you're a business that is maybe already closed or it's still struggling, it may not be enough. And how many businesses do you anticipate will continue to close over the next 6 months to a year? Because it's still going to take us a while to get to the backside of this pandemic.
Absolutely. And just because some people are back in their office in 2 weeks doesn't mean that everybody's back full time and everybody wants to go out all the time either, right? I know people who've now gotten their vaccines and they're just now starting to think about well, okay, maybe I can go get a massage, right? Some people have been getting massages as long as they've been able to. Other people have, safety concerns and medical concerns that they worry about. So there's always going to be that transition period. And to your point, $244 million to Oakland County, that does sound like a lot of money, but there's over 6,000 businesses in Troy alone, right? So I mean, you start thinking about how that would play out. It rapidly decreases. Plus, the other aspect is, one-time boosts of cash certainly have an effect in some respect, but there's got to be a sustainability factor as well. Like, I think to your point, it doesn't do any good to give somebody a grant now if it's just going to prolong the potential death, right? So I mean, we've got to make sure that if you do that, there's going to be a way for them to rebuild their business in a timely fashion. Otherwise, it's not going to work.
So with that, Mr. Mayor, if we can ask, so many, government entities such as yours, we've all been virtual throughout this time. What's it going to be like? Are you doing in-person meetings yet for your council?
Timely question. So we had one in-person meeting April 12th because the legislature had sunsetted the exemption to allow for virtual meetings with the Open Meetings Act that ended March 31st. And, we thought, okay, things were looking pretty good. So we went back to an in-person meeting April 12th. But by the time we had that meeting, we were spiking again, as you recall, and things were very bad. Our hospitals were at capacity. People were worried. There was a real health issue. And so we at that meeting went into a local state of emergency, which was a way for us to have continued virtual meetings. Well, flash forward, last night we had a virtual meeting where we just voted to terminate that state of emergency effective in 2 weeks from now. So we'll be back to in-person meetings on May 24th. But it's going to be a hybrid that allows for anybody who has a medical issue, they can stay remotely participating. Same with our public. We recognize that a big part of our meetings and being open under the Open Meetings Act is allowing that public engagement, interaction, at public comment. But we didn't want it to require anybody to have to come in person to our meetings if they were worried, but they wanted to speak up about something very important to them. So we amended our rules to allow for a hybrid approach. You will be able to come into City Hall and speak at the podium for public comment if you want, but you can also call in, leave a voicemail, email us, and we'll read it in public record, or we'll have Zoom access available as well. So we're doing everything we can to ensure that the most amount of people have the option to come in for public comment, whether virtually or in person.
Well, in some cases, for some people, it's actually worked out better because they would probably not take the time to go to a school board meeting or maybe a city council meeting. But if you can pop in via Zoom, turn your camera off, but still listen in while you're making dinner or helping the kids with homework, it's a little bit more accessible for them. But do you think that's going to continue? Because we do know there are rules and regulations with the Open Meetings Act. Would it take really a movement by the state legislature to try to make this a new model going forward?
Well, my understanding is we have the ability at the local level to amend our rules to allow for that remote participation from the members of the public. It's a little bit different for the governing bodies themselves. The Open Meetings Act doesn't allow for remote participation as a general rule and to vote unless there is a medical issue or a military reason. But the members of the public, my understanding based on the research our city attorney has done and how we've crafted our rules is that can continue. And for the city of Troy, it will continue. I'm not going to say forever because I don't know, but right now it's indefinite until we are surely on the backside of this pandemic. And you're right, though, it has brought about a new type of community engagement and the ability for people who wouldn't normally be able to leave the house during an evening when they've got kids that they're trying to get dinner or get to bed for school the next day. Instead of going down to City Hall or their school board, they can just log in from home and listen and even participate where they never were able to before. So there's definitely benefits that have come out of it.
We're talking with Ethan Baker. He's the mayor for the city of Troy. And with that, Mr. Mayor, I do have to ask you, did you get a heads up at all on the plans for the new intersection at 75 and Big Beaver? Because it is so confusing.
Well, let me tell you this. Yes, we knew about it. It's been part of the plan for a long time, several years now. When we knew that they were going to modernize I-75, early on the plans called for that diverging diamond interchange, which when you're used to the simple clover leaf that you've done 100 million times, it is a little bit like, wait, where am I going now? And
I'll take a roundabout over that.
Well, it's different. You know, the interesting thing is, once you do get used to these diverging diamond interchanges, they are actually safer and they move traffic through much faster. So I don't want to discourage anybody from getting off at the Big Beaver exit on the I-75 and going to our businesses and the restaurants there, because we need you to be there. That area has been under construction for a couple of years, and before the pandemic, those businesses and restaurants were really struggling. So please don't be afraid. Just because Ronnie's afraid, you don't have to be afraid. But I will say, be mindful and recognize, you know, you're going to go on what seems like the wrong side of the road, and you're navigating that in already a busy intersection. But you'll get used to it and you'll end up loving it. I'm really sure of that, Ronnie.
Well, let's hope so. But I will say I had a bit of a panic attack because I was like, wait, how did I end up on the wrong side of the road? Am I going to hit someone? You know, but again, once we all become used to it, because there are still some orange barrels around there, which kind of adds to the confusion as well.
Well, just wait. I mean, I don't know if you've done it in the dark yet. That's a whole other issue. The first time I did it, I went down after a meeting and it had just opened that day and it was dark. And I thought, what am I doing? I have no idea. And there were still a lot of lane closures, but you figure it out.
We'll figure it out. Ethan Baker with us here on the Megacast. With that too, Mr. Mayor, it does seem like we kind of are starting to hit a wall when it comes to the vaccine and hesitancy within our community. But we know we have these thresholds to reach in order for the governor to say that we are going to be able to reopen. What are your thoughts on that as a mayor?
Yeah, I mean, I think as long as we're tied to vaccination rates as a metric for reopening, it behooves all of us to take a good hard look at that. And you still see millions of people are getting vaccines throughout the week. But there is definitely a slowdown. And I don't know exactly why that is. And I can't really speculate. I will notice that we had a Johnson & Johnson vaccine event that the federal government had planned here for us in Troy at the community center. It was supposed to be this week. You know, the Johnson & Johnson shot's the one and done, which is appealing to a lot of people.
That's the one I had.
But they canceled it because only 16 people had signed up. And so that was very telling to us. That just broke to us yesterday. And, you know, you certainly encourage, everyone's got a right to deal with the vaccine how they see fit. But at a certain point, you look at if the metrics needed to get things back to normal are the vaccination rates, take a good, hard, deep look at that and see what really matters to you. And, you know, get out and get vaccinated if you feel safe and healthy to do so. And it's the right choice for you and your family. And I think most people are doing that. Maybe it's just the time of year. It slowed down a little bit. I mean, I know that sounds crazy, but this is it becomes a busy time of year when school graduations and other things start filling in the calendar. So there could be a lot of reasons why it slowed down. I think that could be one of them.
Yeah, and I wonder too, it's like some of this has been the messaging throughout the entire pandemic, because even though it's new, you're still pushing for something that you don't know all the answers to. And maybe that's adding to the hesitancy, because we know at some point in time, like, you know, to go to the ball game, maybe you may have to have it, or to travel. But we should remind people that there have been certain things in place prior to this. I went to Africa a few years ago. We had to get a whole list of vaccines in order to fly, but for some reason I didn't think twice about it then. But now I think it's because it's so new.
It is. It's new, and it's, I mean, I don't have to tell you, and I try to stay very, nonpartisan. I'm a nonpartisan mayor of the city, even though I have my political leanings, but you've seen so much coming out of Washington this past couple of years with the campaign and the rhetoric that it gets amplified. That's another reason certainly that there's a hesitancy for some to get vaccinated. But yeah, it's tough, Ronnie. I don't really know. I don't know what to say other than I know plenty of people who are getting vaccinated every day still. And, I said at our council meeting last night, the good news about tying things to a metric of a vaccination rate is that rate doesn't go down, right? As long every day it's going to go higher and higher in some respect. So that's going to be a good thing for our city and our community and our country as a whole. But we got to figure it out.
So with that, as the elected leader, we do know it's anticipated that the Pfizer vaccine is going to be approved this week for kids ages 12 to 15. From a city standpoint, from an elected leader standpoint, what are your thoughts, or have there been any discussions about requiring vaccines or negative COVID tests to be able to attend certain city-sponsored events?
Well, we have not had really discussions on that aspect of it. Partially, one, because we don't have a lot of city-sponsored events that would put us in that kind of position. With the school district runs completely separately than us, so that's a school issue. And I met with Dr. Macheski last week, our superintendent. We talked a lot about that. I think it's a lot of parents in our city want to know what the expectation is for the fall. And Dr. Macheski's plan, and the school district in Troy is planning to they're planning for a full normal school year starting in the fall. We talked about the vaccine a little bit, and he didn't have any breaking news on that either, and what the plan was. But so short answer, actually, after I've blabbered on a little bit, we don't really have any plans or conversations as it relates to that. We're not that we don't have sports stadiums, we don't have performing arts centers, so we don't have a lot of things that bring a lot of people together indoors that you would look at something like that, like another city might.
One of the things that we are continuing to see right now, the shortage of employees. How is that hitting the city of Troy and the businesses there in your community?
Well, it's just like it is everywhere else, right? I mean, there's an issue when trying to get people working in our restaurants often, some of our office jobs. Where it's really affected the city itself is with our library. We get asked at least once every day, when is your library going to be back open? And really, it's a staffing issue for us right now. We were kind of understaffed going into the pandemic because of some political stuff with our library over the past 10 years. But what that meant is we had a disproportionately high amount of part-time employees. And in the pandemic, a part-time employee was basically, they're not as tied into making it work and get through. So we've had staffing issues. So we're trying to correct that. We did some budgeting stuff with our new budget that we approved last night, and a millage that was approved last fall to increase funding for the library. So that's going to be resolved. But it's like everything. I mean, as a city government, we face that. Our restaurants are facing that. Our service industry, it's out there. It's real. We have to get through it, and I'm sure we will, but it takes time.
But the one thing I think so many people didn't anticipate in the middle of a pandemic is this hot housing market right now. It's happening in your community as well. Long-term, what does that mean for your budget?
Well, as long as the market stays hot, and the market doesn't have to stay hot, but as long as the values stay hot from this perspective, it's good for our bottom line as we move forward from a property tax collection base. But you have to remember, I mean, yes, we're having turnover and a lot of houses selling, but still the bulk of our real estate is the taxable value is so low in comparison to what you're going to get as a market rate right now. And we're still making up for the value we lost in the Great Recession in 2008 and 2009. But yeah, I mean, every time a new house or a house in Troy sells for twice what it was before, that property tax is they're going to be more taxes collected from that. So it's a good thing in that respect, but it's not as much of a big deal as you may think it would be, just because we still, we don't have that much turnover, frankly. People like to stay in Troy, so they're not selling that much.
It is by far every year ranked one of the best cities to live in as well. And with that, Mr. Mayor, anything maybe I didn't touch on that you want to add before we say goodbye today?
Sure. Just really briefly, we did approve our budget last night for the fiscal year 21 to 22. We heavy focus on our public safety, body cams for our police, new fire truck, our fire apparatus, focus on trails and pathways and our parks and roads, of course. So the bread and butter issues. And I'm doing a State of the City address next Wednesday at 6 p.m. That'll be streaming live on the city's YouTube channel and the cable channels. I'm looking forward to it. It's a tradition we haven't done in our city. It's been about 6 or 7 years, I think, since the mayor's done it. I'm happy to bring it back and to talk the good things about Troy to everybody.
So what made you want to bring it back this year?
I had intended to bring it back last year after I got elected in 2019, but the pandemic happened and the timing just didn't feel right. I just think it's a good tradition for our city. It's a good community process, and I work in close contact with the Troy Chamber of Commerce, and we're kind of doing it in partnership with them. And I think it's the right thing to do. I mean, Troy has a lot to offer, and anything I can do to amplify that message anywhere and everywhere, I'll do it. And the state of the city seems like a very logical place to do it.
So will you have anyone in the audience at all, or is it just going to be you in your office?
It'll be outdoors, and we will have a small audience. Our fellow council members will be there. Some of our community and business leaders. Ronnie, if you're looking for a ticket, I could maybe sneak one for you. We'll see what your schedule is like. It'll be a small audience. We're still doing responsible outdoor events at this point, but yeah, I will have a small audience there, so that'll be nice too.
Well, that's great because it really changes the delivery when you can speak to people directly, or even if it's a small crowd, just to be able to look people in the eye.
Oh, absolutely, and plus you can get a read from three-dimensional people that you can't get even on the computer screen, right? So, I mean, it's nice to have that interplay a little bit, and you know when you're doing well and you know when you're not doing well too. So that's always fun.
Well, and let's just hope too that one of the good things to come out of this pandemic, people really are starting to pay more attention to their elected leaders, especially on the local level. So hopefully people will continue to be engaged in our political process. So we wish you the best of luck on your speech. Always a little nerve-wracking to write those and stand in front of a crowd, but I'm sure you'll do a good job. We always appreciate your time.
I'm happy to be here always. I hope the Megacast stays because I love it. So.
Well, thank you. And as a reminder to everyone, please support local. Our businesses are the backbone of our community and make us unique. With that, it's going to wrap it up for today's edition of the Megacast. We'll be back here tomorrow bright and early, starting at 10 a.m. Until then, you can always catch previous episodes on civiccentertv.com.